Good evening, students. Welcome to my YouTube channel. This is Vamshi Krishna. Today, we are going to see some of the multiple choice questions related to community health nursing. The first question is: epidemiological trade are all include except. So, in the case of epidemiological trade, the four options among these four options which is not related to epidemiological trade. The options are option A host, option B environment, option C agent, option D investigator. The right answer is option D. Investigator is not come under the epidemiological trait. The next question is zero incidence is. So what is the meaning of zero incidence? The options are option A elimination of disease, option B eradication of disease, option C elimination of infection, option D eradication of infection. The right answer is elimination of disease. So the elimination of disease is nothing but there is no new cases or there is no cases regarding a particular disease. That is called zero incidence. The next question is silent epidemic of the country. So what is the meaning of silent epidemic? The options are option A coronary artery disease, option B chronic liver disease, option C chronic obstructive pulmonary disease, option D Alzheimer's disease. The right answer is option D. Alzheimer's disease is nothing but silent epidemic of the country. So there is no spread of infection, there is no it is not a communicable disease, so it is called silent epidemic. The next question is the disease imported in a country which was not otherwise present. So when the disease enter into a particular country which is not otherwise present, the options are option A epidemic disease, option B zoonotic disease, option C exotic disease, option D epizootic disease. The right answer is exotic disease. Exotic disease, it is a disease imported in the country or when the disease is transmitted or enter into a country and also which is not present in the country. That means there is no finding of a disease even though enter into a particular country. That is called exotic disease. The next question is first case comes to notice of a physician. So when the case related to any new disease, when it is comes to the physician, that is first notice. What it is called? The options are option A primary case, option B index case, option C secondary case, option D refer case. The right answer is option B. Option B is the index case. When the case newly comes to the physician for a treatment, that is first time ever seen in before in a particular time, that case comes under the index case. So the next question is the freshly prepared ORS. ORS is nothing but oral rehydration solution, should not be used after. So what is the limited time of the using of ORS? The options are option A 6 hours, option B 12 hours, option C 18 hours, option D 24 hours. The right option is 24 hours. So when we prepare the ORS solution, we should not use after the 24 hours of preparation. The next question is, what number of sputum specimens collected to diagnose the tuberculosis in dots? So to diagnose the tuberculosis, it's nothing but TB. How many specimens we are need to collect from the patient? The options are option A 3 samples, option B 2 samples, option C 1 sample, option D 4 samples. The right option is option A 3 samples. So we need to collect the specimens that is from the expecting tuberculosis patient. That is, we have to collect 3 samples. The next question is, what is health index? So what is the meaning of health index in a community? The options are option A animal population, option B human population, option C the rate of infections, option D health status of a people. The right option is the right option is option D health status of people. It is also called nothing but health index. So when the people are having the health status of the in a community, that is finding by the health index. The next question is, what is the barometer of social welfare? This is a very important question repeatedly asking in the exams. The options are leprosy, option B, tuberculosis, option C, heart diseases, option D, jaundice. The right answer is tuberculosis. Tuberculosis, it is a very communicable disease. It is also known as barometer of social welfare. So when the poor people are more risk for the affecting with the tuberculosis disease. The next question is, what is the disability rate? So what is the disability rate? The options are source of infection, option B disease rate, option C percentage of infection, option D none of the above. The right option is disease rate. So disability rate is nothing but disease rate. In a particular population, how many members or how many people are diseased with the a particular or a type of infection, that is called disability rate. The next question is, what is the current literacy of India? So in India, what is the current literacy? The options are option A 74.04%, option B 78.33%, option C 55.3%, option D 36.12%. The right option is option A 74.04%. So this percent of the literacy present in our country. The next question is, what is the statement of Alma Ata conference? So what is the aim of this conference, that is Alma Ata? The options are option A people health in the hospital. So it is the people health is based on the hospitals. Option B people's health on the people's hand. Option C people health on government. Option D all of the above. The right option is option B. Option B is the people health on people hand. That means the way of life lifestyle of the people, it depends on their health status. So the main aim of this Alma Ata conference is people's health on people's hand. The next question is, when do we celebrate World Health Day? The options are option A, April 7th, option B, January 9th, option C, May 1st week, option D, December 6th. The right option is option A, April 7th. On the day of April 7th, we celebrate World Health Day. The next question is concept of primordial prevention. So what is the concept of primordial prevention? There are four types of prevention: primordial, primary, secondary and tertiary. So among this primordial prevention what it means? The options are option A, environment, option B, economy, option C, culture, option D, all of the above. So the right option is option D is the right option. So in the concept of primordial prevention, the environment, economy, culture, lifestyle of the people, all these concepts will come under the primordial prevention. That means before affecting with the infection, we are preventing the entry of organism into the body, that is infection. So before entering the organism into the body, what are the preventive measures we follow, which are comes under the primordial prevention. The next question is, what is a pandemic? What is the meaning of pandemic? The right options, the options are option A, spread of infection in one region, option B, spread of infection in one country, option C, spread of infection worldwide, option D, spread of infection from one region. The right option is option C, spread of infection worldwide. When the infection is present all over the world, it is called pandemic. The best example for the pandemic infection is recently what we have seen, that is COVID. So COVID infection is a type of pandemic disease. The next question is, what is holoendemic? So what is the meaning of holoendemic? The options are option A, some people in one group. When the infection is present in some people in a one group. The B option is only one gender of a group. Option C is every individual in the population. Option D, tribal groups. The right option is option C. So when the infection is present in the all population in a all individual, it is called holoendemic. The next question is, what is anthropozoonosis? What is the meaning of anthropozoonosis? The options are option A, infection transmitted from human to animals. Option B, infection transmitted from animals to human. Option C, infection transmitted from human to human. Option D, none of the above. The right option is option A. Option A is the infection transmitted from human to animals is called anthropozoonosis. The next question is, who is the host? So in the cycle of infection, we have the agent, host, mode of transmission. So among this, what is the host. The options are option A, mode of transmission, option B, presence of infection in the body, option C, growing environment for the other organisms, option D, exit from the body. The right option is option C is the right answer. That the neutral environment which is suitable for the microorganisms, that environment is present in a living body. It may known as host. The next question is, what are the health determinants? Sorry, this is spelling mistake. Health determinants. The options are agents, option B, sources, option C, mode of transmission, option C, control measures. The right option is control measures. Option D is the right answer. So, the health determinants are the control measures of infection prevention. The last question is, what are the nosocomial infection? So, what is the meaning of nosocomial infection? The options are option A, infections occur in a hospital, option B, infections from a public toilets, option C, infections on from the insects, infection from the plants. The right option is option A, infections occur in a hospital, that is called nosocomial infection, or other name is hospital acquired infections.